Hi, Get the Gloss. My name is Dr. Nina Bal. I am a cosmetic dental surgeon and a facial aesthetic physician. One really common question that I get asked all the time is, can I have more volume in my lips but not a really unnatural pout? So I think what has to be said is the lips is perhaps one of the most difficult areas. So just make sure you go to a very experienced practitioner and make sure you look at the before and after photos, because the way you can get really natural, fuller lips is by, first of all, respecting the shape and anatomy of your lips. When the practitioner starts to inject in trying to change it, that's when everything goes wrong. There's a couple of rules that I normally follow. First of all is actually injecting in the actual lips, in the body of the lips. So sometimes my patients come complaining, they've been to other practitioners, and the filler actually is not in the lips, is above the lips. Yes, it could be a migration of the filler, which is quite unusual, but it could be just that the filler has been injected above the lips. So first of all, injecting in the body of the lips, which is mean in the pink mucosa. Second of all, respecting the shape and the anatomy. Third of all is making sure they use a hyaluronic acid derma fillers. There's a lot of fillers out there in the market. Make sure the filler that has injected in your lips, it's a temporary filler. So hyaluronic acid is basically the collagen that we have in our lips naturally, but we just lose as we age. So that way it's very natural. It dissolves after 12 months and we can actually dissolve it with a specific enzyme. And also another rule that I normally follow is never to inject in the middle of the cupid bow, because otherwise if you inject here from the side, it gives a very unnatural projection. I'm sure you might have seen those lips. So this is a massive giveaway of lip fillers done badly. The problem is that the lips do not forgive. So even if you inject a tiny amount in the wrong place, or if you change the anatomy of the shape of the lips, then it shows. And the problem is that if sometimes as well, if it's injected in the wrong tissue plane or the wrong filler, it can be stuck there for years and years and years. So then we only have the option to actually dissolve that with something called hyalase or hyaluronidase, which is a specific enzyme that we can dissolve, we can inject in the lips. Yes, it does dissolve the filler, but people might not know that the hyalase also dissolves your own collagen. It cannot differentiate between hyaluronic acid fillers and your own collagen. So that's the problem, that we have to be super careful, super conservative, but still you will lose your own collagen production.
So best thing is to get somebody who gets it right first time.
Exactly, that's the best thing. You save so much time, so much money, so just get it right the first time. Absolutely.
And you correct quite a lot of botched filler jobs. What sort of things do you see?
I do. So the main issues that I see is filler injected in the mainly is upper lip is the main problem, where it gets a bit messy. It's either the migration or the injection above the lateral side of your upper lip, so the puffiness here, or the very common where the cupid has been completely changed, has been overfilled, so it just gives this a very unnatural projection which looks awful.
And what would make a filler migrate?
It can happen. It could be a question of not using the correct filler, of injecting in the wrong place, or sometimes over time, if you have too much injected too often, that can also happen. So another rule is to inject or too much. So I never inject personally more than 1 ml in total per appointment, because again, if you inject too much, then it easily migrates. So use a really high quality filler, never more than 1 ml in the right place.